name is Ilyssa Gordon. I'm Associate Professor of Pathology and Medical Director for Sustainability at the Cleveland Clinic. And today I'm going to talk to you about hospital resilience as it relates to the laboratory. The learning objectives for my talk are to identify opportunities for resiliency within the hospital laboratory setting, and to discuss strategies to reduce resource overutilization in the hospital laboratory. First, we need to define what we mean by resilience. Resilience is the ability to recover from or resist being affected by a shock to the system. In this talk, I will describe the major systems that are essential for running a laboratory and the ways that laboratories can be prepared to recover from and resist being affected by a shock or disruption to the system. Hospital laboratories contribute to overall energy consumption, carbon footprint, regulated medical waste, landfill waste, chemical and solvent waste, and water use of the hospital. So there are many opportunities to prepare for disruption. First, we're going to talk about energy. One thing that I want to point out is that of the 10% of greenhouse gas emissions that the healthcare sector contributes to total US greenhouse gas emissions, about 36% of that is attributable to the generation of supplied power. Hospital labs are in use up to 24 hours per day. Lighting, heating, ventilation, and air conditioning, or HVAC, refrigerators and freezers, and many other pieces of equipment must remain on at all times. At the Cleveland Clinic, we run about 2,000 different kinds of tests. So many different types of equipment and analyzers are needed to be maintained and ready to use. And if the refrigerators or freezers can't stay on, specimens needing testing will be lost. If the ventilation system isn't working, our ability to perform sterile testing will be lost. In this overview of the microbiology laboratory space, you can see all of these energy-consuming systems that the lab relies on to function. I'll let you take a moment to see if you can identify as many as you can on your own before I point some of the ones that I see out to you. So hopefully you saw lighting, and these here are some ducts for the heating, ventilation, and air conditioning system that controls the ambient temperature in the room. Over here is a door and a window which closes off our sterile room, which requires its own specialized ventilation. Here and here we have special refrigerators and incubators for cold storage and for heating and incubation of specimens. Here in the front we have testing equipment. We also have computers, monitors, and printers. Disruptions in energy can occur at multiple levels, and the lab needs to be prepared to handle each one. If a single freezer breaks down, is there a plan in place for prioritizing frozen specimens? What needs to be saved first? If a single piece of equipment short circuits, is there any backup equipment? Is there send-out capacity for that test? Establishing partnerships with other laboratories, both reference laboratories and neighboring hospital laboratories, is an important component of being prepared. If power to one floor of the lab building or the whole lab building goes out, we need to have backup power. Usually, this consists of generators, which can keep the lab running. If power to the whole hospital or the whole city goes out, we need to have a backup plan. It is essential to prepare in advance for these possibilities. While these opportunities for resilience planning related to energy use in the labs may seem remote, there are benefits to reducing energy use in the laboratory that can help decrease the lab's carbon footprint and decrease demand on the energy grid. At the Cleveland Clinic, many of our clinical labs are housed in in a LEED certified building, but this is not the case for the majority of hospital labs around the country. Most labs have to work within the constraints of the existing building design when considering energy efficient improvements to reduce the carbon footprint of the laboratory. This requires working together with a multidisciplinary team, including the hospital's sustainability manager, engineering, buildings and design professionals, lab directors, and lab managers. Regarding lighting, automatic occupancy lighting sensors can be installed so that lights in less used areas aren't left on when not in use. Regarding HVAC, air exchanges for sterile areas should be optimized to the current standards. Many pieces of laboratory equipment, including freezers, biologic safety cabinets, and fume hoods, consume energy to some extent even when not in use. Capital purchases of equipment do not usually take into account or emphasize energy efficiency in most laboratory settings. However, identifying equipment that can be turned off at the end of a shift or at the end of each day without affecting the test validation process is a good option. Also, shutting the sash on fume hoods when not in use saves energy. Think of it like closing your car windows when you have the air conditioning on. My colleague Ken Kula in our medical art department created these graphics for me, which illustrate some of the points about closing the fume hood sash, which you can see here. And about turning off equipment we may not be using, which you can see here. We've covered energy. Next, we'll take a look at supply chain. Because the laboratory is running 24 hours a day, supplies are needed 24 hours a day. Space is needed to store appropriate on-hand supplies, and we need all of the various supplies needed to run those 2,000 different kinds of tests. Commonly, when thinking of laboratories, people think of chemicals, which yes, we do use. We need to maintain key reagents in stock in order to reliably run tests. Beyond the blood vials and specimen cups that any consumer of healthcare may be familiar with, within the lab we have many more kits, vials, racks, and other items that we need to keep in stock. Finally, incubators for specimens like blood cultures need to be supplied with specified ranges of gases to maintain the appropriate atmosphere. Also, liquid nitrogen is used for flash freezing of tissues. So there are quite a variety of supplies that the lab relies on to function. As we've learned from the current pandemic, supply chain shortages do happen and do affect laboratory testing. The CDC and Department of Health and Human Services recently released this notice to providers about shortages of test kits and laboratory supplies for testing of sexually transmitted infections, affecting multiple companies and impacting several components of the specimen collection and testing process. Let's take another look at the same overview of the microbiology laboratory space I showed earlier. Now, I'd like you to take a look and see all of the products and supplies that you can find that the lab relies on to function. I'll give you a moment to do that. We can see durable goods like desks, chairs, monitors, and equipment. Reusable goods like lab coats, racks, bins, and single-use item like reagent containers, specimen and sample containers, plates, and tubes. As with energy, disruptions in supply chains can occur at multiple levels, and the lab needs to be prepared to handle each one. If a lab runs out of a testing kit for a test that is run daily, be sure there's a plan in place for communicating to ordering providers and establish prioritization of testing to best utilize remaining stock until new stock arrives. Is there a different test that could be run to answer the same question, such as a molecular test instead of an immunohistochemical test? Is there send-out capacity for that test? Once again, this is where our partnerships with other laboratories are key to have in place. What if supply of a reagent or collection tube is short at the manufacturer level? We need to have prepared communication pathways to receive timely information from reliable sources and be able to share with pathologists and ordering providers, similar to the CDC notice we just saw. One way to be prepared to handle disruptions to the system is to consider reduction strategies for the use of supplies. Can a reusable item be used instead of a disposable item? Do you recycle solvents in your laboratory? Have you taken a look at chemical use in your laboratory protocols to try to reduce or minimize use of various chemicals? Have you looked at water use in protocols and washing procedures? Also, workflow optimization can help limit supply use. I want to take a minute to let you know about pathologists. Pathologists are the medical directors of hospital laboratories. We create budgets, we approve capital purchases of new equipment, we perform and oversee procedures, and determine testing schedules, how many runs per shift, per day, and per week, and we ensure staffing is maintained by qualified laboratory technicians. To pathologists, the laboratory technicians are equivalent to nurses. Nearly all hospital inpatient encounters and many outpatient encounters utilize the hospital laboratory services. Keep in mind, what happens in the hospital labs affects all physicians and most patients, not just pathologists. Reducing overutilization of resources in the laboratories contributes to hospital resilience, cost savings, and a healthier environment. In these last few slides, I wanted to let you know about some additional aspects of laboratory resilience, looking outside our laboratory walls. Some laboratory supply companies are already starting to look closely at their manufacturing processes for opportunities to reduce the carbon footprint or energy intensity of production and for resource reduction to better withstand supply chain fluctuations. Given that we're in the midst of hurricane season, I also wanted to share with you this lab management article from 2018 about laboratory resilience related to hurricane preparedness, but which can certainly apply to other large-scale natural disasters, such as wildfires and flooding that different parts of the country experience. Many of the points that the author makes here are similar to what we've already discussed. In addition, she highlights the need for strategic generator placement. Put it on the roof rather than the basement to avoid flooding. She also talks about the use of point-of-care testing, which is laboratory testing done outside of the laboratory space, as well as having a recovery plan. Importantly, communication and the need to plan in advance are also emphasized. And finally, looking ahead to technology that can help with our resilience efforts, where pathologists are really looking to the future. The concept of when there are no roads can be applied to rural areas, but also extreme weather events, and when roads may be flooded or communities may be cut off from hospital access due to closing of roads from fires or hurricanes. This article discusses the opportunities for drone use in sample transport related to road closures. In conclusion, opportunities for resiliency in the laboratory have been discussed, as well as strategies to reduce resource overutilization. We talked about these concepts as they relate to energy and laboratory supplies and the supply chain. The key takeaway I'd like you to have based on this lecture is to plan in advance. Thank you, and I'll be happy to take any questions during the Q&A time.
Thank you for the opportunity to present. I have nothing to disclose, and the views and opinions presented here are my own. Today, I hope we understand the effects of climate change on public health, understand the effects of climate change on surgery in particular, understand the contributions of healthcare facilities to climate change, and propose solutions to increasing healthcare sustainability in operating room environments. When we think of conditions or actions that have been collectively affecting public and population health, diseases like obesity, smoking, heart disease, recently COVID-19, and others come to mind. Attention has, in some fashion, recently focused on climate change and its negative effects on public health, but the spotlight is not bright enough. Evidence links lung cancers, other respiratory and cardiac problems, gastrointestinal, vector-borne illnesses, waterborne illnesses, allergies, and other diseases to fossil fuels and climate change. According to Lancet, climate change is the biggest global health threat of the 21st century. The impacts will be felt all around the world, not just in some distant future, but in our lifetimes and those of our children. Action on climate change is imperative to preserve human life. Every year, an estimated 12.6 million people die as a result of living or working in an unhealthy environment. Environmental risk factors such as air, water, and soil pollution, chemical exposures, climate change, and UV radiation contribute to more than 100 types of diseases or injuries. And over the past 3 decades, national asthma rates have more than doubled. Areas of Northeast Ohio are designated by the US EPA as non-attainment zones. The Northeast Ohio area ranked the 11th worst over 200 metropolitan areas nationwide for year-round particle air pollution. In Cleveland, this pollution can often be visible, which is shown here as a haze over the city, is captured by the haze cam run by Dr. Sumita Khatri, Cleveland Clinic pulmonologist in the Respiratory Institute. As we know, climate change can lead to extreme weather events. The events caused by climate change have not only caused significant damage to buildings and infrastructure through direct impacts of flooding, but have negatively impacted telecommunications and subsequently safer delivery and access to healthcare. Operating rooms have certainly been affected, as safe surgical care should not be delivered in damaged or less than ideal environments. As nearly 1/3 of global disease is attributed to surgically treatable conditions, access to safe operating rooms is critical. Extreme weather events have led to halts or delays in pharmaceutical and device production, leading to a lack of access of drugs and supplies necessary for surgical patients and surgeries. Climate change, causing extreme weather events, can negatively affect access to food and food production, contributing to nutritional deficits and subsequent poor wound healing, which is detrimental to the success of surgical operations. Additionally, excessive heat caused by climate change increases the number of violent crimes, thereby increasing hospital emergency department visits and traumas, and subsequently surgical volumes. This can be devastating to populations already affected by disparities and a lack of access to adequate healthcare. It's time clinicians think of work in the sustainability sector as not an extra, but as a necessary part of our practice to maintain public health. Physicians have an ethical obligation to protect health. We're generally governed by 4 ethical principles. Beneficence are the actions carried out to promote the well-being of others. Non-malfeasance, commonly known as first do no harm. Justice, and autonomy and respect. We must recognize that people living in a healthy environment will be healthier people and integrate sustainability practices into our fabrics. But it seems as though the very thing we're trying to protect and improve, health, is negatively affected by how we deliver healthcare in our buildings and day-to-day operations. Healthcare facilities are the second most energy-intensive commercial buildings behind only food service. The healthcare system accounts for 9% of US commercial energy expenditure and is the second leading cause of waste in the United States. US healthcare systems account for 8 to 10% of greenhouse gas emissions, which significantly impacts climate change and subsequently health. The operating room, or ORs, account for 20 to 40% of hospital waste. Up to 70% of water used during surgical scrubbing can be wasted. Excessive waste generation, improper disposal, and consumption of energy and national resources have significant negative effects on the environment. As an industry, we need to acknowledge that our operations impact our health and our community and the health of our patients. In everything we do, we must be deliberate in aligning our actions with the mission of healthcare sustainability, especially in how we build, maintain, and operate our facilities, so that we create healthy environments in which to work and heal. A recent Lancet study on carbon footprinting, focusing on 3 large healthcare systems in the United States, Canada, and the UK, found that anesthetic gases and energy consumption are the largest sources of greenhouse gas emissions in operating rooms. They found a 10-fold increase in gas emissions when desflurane was preferentially used, and this is known to be a primary contributor to global anesthetic gas emissions. ORs are 3 to 6 times more energy intensive than hospitals as a whole. This is generally attributed to HVAC systems. HVAC is responsible for 52% of energy needs in inpatient healthcare facilities and 90 to 99% of overall OR energy use, at least was found in this study. So what can we do? We should focus on balancing our carbon emissions with our carbon savings or offsets and aim to achieve carbon neutrality, like the Kaiser system recently did. And this is the first healthcare system in the US to achieve carbon neutrality. We should focus on interventions to reduce environmental costs and the cost of surgery. We need better processes for managing and minimizing OR waste. We need to focus on scavenging and minimizing anesthetic gases, especially desflurane. We need to preferentially use alternative anesthetic agents like regional or IV anesthesia. We need to develop renewable sources of electricity in operating rooms and hospitals. We need to focus on occupancy-based HVAC settings. We need to focus on environmentally sustainable purchasing practices. We should develop similar protocols to enhance recovery after surgery, or ARAS, which is streamlined and improved recovery after many surgical operations. We need to integrate and standardize best practices for OR personnel, including anesthesia, surgery, nursing, technologists, and other perioperative care professionals. We need to create metrics and measurements for OR and environmental sustainability and performance. Most of all, we need to increase awareness and invest in education. As one of the largest healthcare systems in the country, Cleveland Clinic has been committed to greening practices for well over a decade. Our brief list of operating room-based accomplishments includes energy conservation through OR setbacks, which has resulted in over $2 million in cost savings, LED lighting, which increases surgeon comfort and saves 60% of energy use, red bag or regulated medical waste reduction, plastics recycling, and our program has diverted nearly 500 tons from landfills, water reduction, particularly at the scrub sink, single-use device reprocessing, elimination of desflurane from our formulary, and this has significantly reduced our carbon footprint. But perhaps one of our single greatest and most unique achievements is the development of a healthcare sustainability fellowship honoring a former Cleveland Clinic surgeon who died of pancreatic cancer and was passionate about the effects of OR waste on climate change. Every year, one general surgery resident who's interested in healthcare sustainability is selected. We sponsor yearly grand rounds, which are focused on healthcare sustainability and bring nationally and internationally renowned champions to educate our surgeons. Our surgical fellows have a yearly project focusing on many different things. A few have included OR water reduction, regulated medical waste reduction, sterile processing, and instrument waste reduction, energy consumption. These are all physician-led initiatives, and they're made successful through partnerships with multidisciplinary teams, collaboration with our Greening the OR committees, leadership of our sustainability offices, donations and grants, and high-level administrative support. In this fellowship, we have successfully championed plastics recycling, water reduction, regulated medical waste reduction, among others that I've mentioned, and many others that are unmentioned, and substantially reduced the negative impacts of the operating room on climate change and public health in our community. This is why I believe the true future of climate change and surgery rests on the shoulders of all of us, but particularly the next generation of clinicians. Integrating healthcare sustainability into the fabric of their learning is no longer optional, it's mandatory. We and the next generation must understand that climate change negatively affects public health. Healthcare systems are significant contributors. ORs are significant sources of emissions. Educating and engaging all clinicians, especially our future generations, is critical. It's the moral imperative of clinicians to act on climate change and have sustainably driven medical practices. Most importantly, we must stay positive and know that we can change this. Thank you.